and not interesting. And so then my mind starts to kind of like think about ways in which I can address that. So there's two things going on now. One is I came into contact with the fear that I'm going to fail, or I'm not going to do well, or I'm going to be seen as inadequate or some problem. And then my mind tries to come up with strategies to avoid that. So there's two things happening now. One is she came into contact with the fear, and then the mind jumped in and said, like, let me help you escape from that. I don't want you to feel fear, so I'm going to help you plan. We don't really care in ACT what the thoughts are, but we call that experiential avoidance. Your mind, whenever you're overthinking, it doesn't matter what your brain is doing. The function of overthinking is to help you escape from emotions that you don't like. It's an escape maneuver. It's like taking your body for a little walk. So, but we'll kind of stick with it here, okay? So the idea is like you might fail or not do a good job, and other people would see you as not doing a good job.
Yeah.
What about that as a problem? What's the difficulty or the concern with that?
Maybe I feel ashamed, for example.
Shame.
Yeah, shame.
We're going down now into, we're getting closer to her heart. Shame. Tell us about shame. What's the trouble with shame? Or what comes up with shame? What's the fear? What's the problem with shame?
Seems like I lose the confidence.
You lose confidence, you feel shame. And what's the trouble with having loss of confidence and feelings of shame? What's the risk or the danger or the fear with that?
I feel that like if I lose confidence, I feel like I cannot do it.
Can't do it right, and you'll fail. And
Yes, like it seems like I feel exhausted to do it.
Pardon?
Feel exhausted to do it.
Exhausted.
Yes.
Okay, well, you won't, and if you feel exhausted,
Have no powerful to do it.
if you feel exhausted and failing all over the place and not being able to, what's the trouble with that? What's the risk or the danger?
I think it's not harms to me. It's just the feeling, and it's short time. It happens short time, so it's just the feeling. When I do something or anyone encourage me, or when I express this feeling, maybe I feel okay.
So what we're doing here is kind of, thank you very much for doing. First off, you're being very brave by revealing a vulnerability to a group of your peers, and you're willing to teach them by your own suffering. So thank you for suffering so others can learn. But what we have here is, I say perfect, and then your mind says no. And I say, well, what's wrong with you? And it's like, well, I overthink, I can't do presentations well, and it makes me feel that I'm ashamed. And what's the trouble with that? When I feel ashamed, I feel like I'm not able to function the way I would. I can become exhausted and not able to function in the way that I would like. So don't. All I have to say is perfect, and your mind produces, well, no, these are all the bad things that can happen if I were to let myself to think perfect.
Yeah.
So this idea here is you don't like that idea, and so you want to avoid having that feeling, and we avoid that feeling by thinking through things and analyzing things and evaluating things. But that's a core belief in the sense that I can't do it well, and bad things will happen to me. So the idea here is when we do this perfect exercise, we do it with many people. And if I do it with patients, if I do it with doctors, if I do it with students, same. If we spent time here with everyone in the room and said perfect, 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 your mind will say, oh no, I have problems. And the things that would come up are things like, I'm not smart enough, I'm not lovable, I don't connect with people the way I should, I feel like I'm not pretty or attractive enough, I feel like I'm not interesting enough. You all know the thoughts that you have that make you not sleep at night. And we tend to talk to ourselves in very mean ways. You know that if everyone could hear your internal thoughts, you're saying really mean things to yourself a lot. Like, damn, what's wrong with me? Why can't I do this? Why can't I do that? And if you're a patient, doctor, student, same. The same thing. All we have to do is say, you're perfect, and I can hear, I'm not smart enough, I'm not good enough, I'm unlovable, I'm inadequate, I'm broken, I'm many, many things. And I have that too, and we're all the same. I have that too. So right now I'm doing this talk, I'm sitting here talking to you, and I've got all my voices saying like, you're not doing a good job. You're not smart enough to be here. You're not good enough to be here. Very negative thoughts are going on in my head right now. Feeling like I'm not doing a good job. It's part, we call them passengers in act. We have passengers in our mind that stick with us. And so the question becomes then, have a thought like I'm not good enough, I'm not smart enough, I'm not interesting enough, I'm broken in some way. We'll usually ask people two more questions, like how long have you felt this way? And have you tried to get rid of it? And the two answers that almost always come up is, it's been a long time and I cannot get rid of it. So it might go like this. If you were to ask me, how long have you felt like you're not good enough? My deepest core belief is I'm very unlovable. I feel very unlovable. And my wife will say something like, oh, I love you. My mind immediately says, you just don't know me. You don't know me. If you knew me, you would have known me. So that's a core belief. And even now, when I speak that to you, it's painful. But the question becomes, how long have I had that belief? My whole life. My parents didn't abuse me, nothing bad happened. But I have this belief. It's been part of my life for my whole life. Do I like it? No, I do not. Have I tried to get rid of it? Yes, I have. Have I been successful? No, I'm not. It's there every minute of my life. So this is interesting, right? It's interesting, the idea. I'm a mental health professional, and you're all mental health professionals. I have this thought that's painful and hurtful. I've had it my whole life. I don't like it, and I can't make it go away. So what's a good conclusion to be drawn? It's not going away. Never. And I can't CBT it away. I can't medicate it away. I can't communicate it away. It's just there, and it will be there. So the first part of acceptance and commitment therapy is many times the struggles that we have inside that we don't like, these thoughts and feelings that interfere with good living, aren't going away. And what can I do about that? If I can't get rid of it, what's my only option? Accept it. Accept that it's part of who I am. Accept that it's part of my experience. That's the best I can do. So the first part of acceptance and commitment therapy is like learning to identify these core beliefs. I'm not going to always point to your whole stuff, but the idea being CBT kind of would say like, we're going to help you feel lovable. So CBT might be every time you say I'm unlovable, say to yourself, I'm lovable. Try to replace it with a good thought. And the ACT model is, no, that's not going to work. You can't. So every time you have that thought, just have that thought. Don't do anything. Just have it.
So it's okay to accept not 100% perfect.
Go on. Right, that's what you have, that 100% not 100% perfect.
So we need to accept it.
To accept that
Accept that
idea that you're
feeling,
not
the
perfect.
idea.
Yeah, it's just, and you never will. And you could see a therapist for 100 years and you'll still have it. Welcome to the club. So when a client comes to me and says, you know, Dr. O'Brien, I have this thought that I'm unlovable, let's say, and I've had it for a really long time, or I feel like I'm ugly, or I feel like I'm not interesting, or I feel like I'm weird, and I've had it for a really long time and I can't really get rid of it. I've tried, I've seen therapists, I've read books, I've taken medicine, but I still feel like I'm worthless. And what's wrong with me? I tell them, you're human. You have a very serious diagnosis. It's called human. That's it. You're not broken. Everyone in this room, you know in your heart, have these thoughts and feelings that haunt you and hold you back. And you're not broken if you have them, you're just human. Every single human has that. So in ACT, we kind of recognize this as an idea, and we listen to what people say. If the client says, I've had this thing for a long time, I don't like it, I've tried to get rid of it, and I've been unsuccessful, we just listen to that and say, okay, I believe you. I believe you. You can't change it. I believe you. And then I'll say, well, what are we going to do about that? And I'll say, well, if you've been trying for 25 years to get rid of it and you've been unsuccessful, I think we should just stop trying to get rid of it. To me, when a person comes in and says, help me feel good about myself, help me feel confident about myself, and I say, like, I've been unable to feel good about myself or confident for 20 years, 10 years, 5 years, I don't know. To me, in ACT, it sounds like, Dr. O'Brien, every morning I really want to fly. I see the birds flying and I think it's so cool. So every morning I get up and I flap my arms and I never get off the ground. And I've been trying for 5 years. Your response to that would be, well, humans can't fly. So you probably ought to just give up. When they say, I can't have confidence and I try to have confidence, I'm unsuccessful, I think same thing. Humans can't fly. Humans can't control their thoughts and feelings. It's just a fact. So acceptance and commitment therapy, one of the first differences is we accept as a fact that humans can't control thoughts and feelings very well. And that's normal. That's totally normal. And you're all going to have negative core beliefs. That's also normal among humans. And I'll try to explain that in a minute why. So I'll try to move to a new table so that you guys aren't always attacked or not. But